Dr. Gretchen Hawley. Welcome, Dr. Gretchen. She's a doctor of physical therapy and MS certified specialist. After graduating from Simmons University in Boston, Massachusetts, she developed an MS physical therapy program alongside two of the city's top MS neurologists. Dr. Hawley utilizes the concept of neuroplasticity in her online MS wellness program, the missing link to help her clients reduce fatigue, get stronger, improve their balance, and walk better. Her members feel more energized, empowered, alive, and more like their normal self again. Dr. Hawley has been a keynote speaker at several MS conferences, lectures frequently for MS support groups, and continues to keep herself up to date on the newest and best MS practices by attending the MS Consortium each year. Dr. Hawley resides in Buffalo with her dog, Finn. Welcome, Dr. Gretchen. So excited to have you today.
Thank you for having me. I am so excited to be here, and a huge thank you to Mindy and everyone behind the scenes for putting this on. Virtual events can be chaotic and brand new to a lot of people, attendees as well, and I'm just so honored to be part of this, so thank you for having me. So we're just going to jump right into the presentation, and as Mindy said, if you guys have any questions, there is going to be a few minutes at the end for a Q&A. So we're going to be talking about physical therapy for multiple sclerosis, and I am so passionate about this topic because it is very different than physical therapy for orthopedic reasons like knee pain, back pain, post-surgery, and it's very different than general strengthening exercises. And I can't tell you how many times I've heard the statement of, well, I've tried PT, but it didn't work for me. And it's likely because it wasn't PT specific for multiple sclerosis. So what we're going to be going over in this presentation are a couple of things. And on the next slide, I'm going to show that to you. So the first thing that we're going to talk about is learning the how. How is this actually possible? Because another thing that I hear frequently is, well, I have a progressive disease, that means I can't get stronger. And that's actually not true. So I want to teach you the how first, and then we're going to go into actual exercises that you can do. I'm going to give you 3 of them, so I hope you're ready. And then the last thing is the guidelines, because not only is there a very specific way that we should be doing the exercises, but there are specific guidelines on how you should be doing those specific exercises for MS. So let's jump right on in. The first thing that is extremely important to know, that most of you likely already know, is that there are a few things that need to happen in order for a muscle to move to begin with. So the very first thing is your brain has to have the thought of movement. It has to either be a reflex, like an involuntary reflex, or you have to have the actual thought of reach forward and grab that water bottle. So it has to come from your brain first, then it travels through the nerve, and if there's any issues at the nerve, then that's where the limitation may be coming from, and then it gets the muscle to fire. So there could be issues at each of these levels. The issue could be in the brain, where your brain's not sending the message. There could be an issue at the nerve level, where the brain sends the message to the nerve, but the nerve is working in a faulty way. Or the issue could be at the muscular level. As we all know, with MS, the issue is at the nerve level. So on the next slide, we're going to talk about neuroplasticity. And I hope you know what neuroplasticity is already. If you don't, you're going to hear it again for the first time, but this is something I will always include in my presentations, even if it's a million times, because I truly believe that neuroplasticity is it's the reason that people with MS actually can get stronger and improve their balance. And you need to fully understand it in order to not get as discouraged with exercises. So I'm a firm believer that everyone should know neuroplasticity so well that they could explain it to someone else. So the way that I like to explain it is that it's the ability of our brains to create a new pathway or strengthen an existing pathway to make a movement occur. So as I mentioned from the last slide, in order to improve muscle strength, it has to start from the brain, go through the nerve, and then extend to make that muscle fire. So I have a water bottle right here. So I want to show you an example of what I'm talking about. Let me see if I can show you my water bottle. Okay, so here's my water bottle. So neuroplasticity means that my brain, maybe right here, I'm going to use this hand. Let's say this part of my brain is what needs to fire in order for me to reach forward to grab that water bottle. So if this part of my brain says, okay, Dr. Gretchen, reach for that water bottle, it's going to send a neural pathway here, and maybe my arm doesn't extend at all. Like it meant to, but it just didn't. So I attempt this movement a second time, and I try to reach for it. My brain isn't going to use that same pathway because it didn't work the first time. So on my second attempt, my brain might send this type of pathway. It still didn't work to go further. On the third try, maybe some zigzags. There's a million different ways to get from point A to point B to extend my arm. But the only way to find the way from point A to point B that's going to work is to keep trying. Our brain is not going to use ones that didn't work. So every time you try to do an exercise or try to do a movement, your brain is going to try to find a different way to get from point A to point B. So let's say on my 200,000th try, my brain does maybe a couple different swirls there, and then I'm able to reach for it. Then that means that, okay, we just found a neural pathway that works. So every time that I am going to extend or attempt to extend my arm, my brain is going to use that same pathway, and then I can extend. And keep in mind, this extension, it's not like once your brain finds it, it's going to be perfect and, oh, now this is easy for me to grab my water bottle, but it at least has a pathway that's working. And then every time you practice this movement, it's strengthening that pathway that it found. Similarly, if there's a movement that maybe you can do already, maybe you could reach a little bit, but it's hard and maybe it feels like a ton of bricks, but you can get there, you have a pathway that's working. So for you, every repetition that you try, you're strengthening that pathway that's already there. So this truly is the reason that anyone with MS can get stronger. And I'm using the example of my water bottle right now, but this is true for if you have foot drop or difficulty lifting your leg up to walk. If you have zero movement right now, practicing the movement will encourage your brain to get this neuroplasticity firing so that you can actually find a new pathway. Or if you do have some movement, you're going to be strengthening that pathway that's already there. So this can be good and bad. It's so important, and I'll talk about this more on a different slide, but it's so important that you have good quality, because if I'm reaching, I'm going to put this in front of me now. If I'm reaching for this water bottle and my goal is to reach forward like this, but instead I'm reaching, oh, you can't see it. I'll move it there. But instead of reaching forward, this happens. Then every time I reach for something, my arm's going to move in this weird way. Another example that I like is if for some reason, maybe let's say we're working on feeding ourselves with that coordination. If this is the movement that I want, but every time I practice it, or more times than not, I do this, because that's the way my muscles are working, then when I try to feed myself, my food's going to go over there because that's the movement that I'm practicing. So you have to practice with the exact movement that you are looking for. Okay, so we can move on to the next slide. I hope that makes sense, because it is extremely important. Actually, one last thing about neuroplasticity. We don't know yet how long it takes to occur. So that is one thing that one question I get asked a lot is, okay, well, how long do I need to do this before neuroplasticity kicks in? And unfortunately, we don't know yet. It's not in research of if you do exercises 5 days a week for 60 minutes each time for 6 months, then it'll kick in. For some people, it kicks in I would say within a couple of weeks, I've noticed. Other people, it's a couple of months or a couple of years. So you really have to just trust that this is happening behind the scenes and that over time, you will benefit from it. The main thing I want to point on this slide is that BDNF, also known as brain-derived neurotrophic factor, this is a protein that is released in our bodies when we exercise. And this is a protein that supports the survival of existing neurons and also encourages growth of new neurons and new pathways. So it goes hand in hand with neuroplasticity. And it also has been shown to have cognitive improvement and alleviate depression and anxiety. So that's why when people exercise consistently, they feel so good. We have this endorphin rush because of this protein. And lastly, our brains actually have a reduced inflammatory response when we exercise for at least 20 minutes, which I love when this research came out, because usually people were thinking, okay, I have to exercise for at least 30 minutes, if not 45 minutes or an hour in order for this to be effective, but that's not true. We only need to exercise for 20 minutes to reduce the body's inflammatory response. So let's move on to the next slide. Can you move on to the next slide? There we go. Okay, so this is also extremely important. The biggest difference between exercise like from a personal trainer or just exercise that we learn growing up versus orthopedic physical therapy and MS specific physical therapy is that MS specific PT, it has to be functional exercises. When you are exercising, if you're just doing a general strengthening exercise, then when you have MS, it doesn't always have the same carryover. So I don't know if any of you guys have been to physical therapy before, but a very common and great hip flexor exercise, which hip flexors are the muscle you need to lift your leg up to walk forward or to shift around in your chair, is you need to be able to lift that up. So in regular PT, people will lie on the ground and you have one knee bent, one leg out straight, and you slowly raise it and then slowly lower it, then slowly raise it and slowly lower. And it's a great exercise. However, what people with MS often experience is you could get really strong with that exercise, maybe even 5 out of 5 strength, but you go to stand up and use your hip flexor strength and it's non-existent, it's not there. And that's because that exercise is not functional for walking or for any type of standing or sitting movement because you're lying down. So functional exercise means you pick an activity that's hard for you to do and you break that down into a bunch of different exercises. So I'm going to show you on the next slide, but an example of a non-functional exercise, if your goal is walking, would be this recumbent bicycle. All of my clients love the recumbent bicycle. I love it as well for other reasons, but one thing that I hear a lot is, you know, I've been biking, I've been on the recumbent bicycle or on a stationary bicycle for a long time now, and my walking isn't any better. Well, that's because you're biking, you're not walking. Biking is a helpful exercise if your goal is to bike better, but walking and breaking down those walking exercises would be a helpful exercise if your goal is to walk better. So you really have to think of, what are my goals? If your goal is to stair climb or climb stairs better, then we need to work on breaking down stair climbing. So that's one thing that I would encourage you to do, is figure out what is it that you want to improve, and then we need to break those down into exercises. So let's move on to the next slide. And this is always something that seems to be like mind-blowing to people. So and actually let me show you this in person. So if you can stop sharing the screen, let me back up, just so I become a little bit bigger. Move my chair over to this side. So one thing that a lot of people tell me is that they want to improve their walking, but what they don't realize is that walking is more than just one activity of walking. So basically you need to have balance, you need to have strength in so many different muscle groups. So if I back up here, I hope you can see me. Actually, I'll bend this down. Okay, so in order for me to take a step forward in this direction, what I need to do is I need to shift my weight forward, bend my knee, swoop my toes up, bring my knee up to the ceiling, straighten my knee, put my heel down. I don't know if you guys can see my feet, but my heel is down. All while that was happening, I was standing on one leg. So that's 7 different things, meaning if you have a goal of walking better, all of those 7 things should be something that you work on. And you might feel like some of those are really easy for you. The kicker with walking is that if one of those 7 things isn't working well, your walking will be off. So that's what I mean by a functional exercise. If you have a goal of walking better, you now have 7 exercises that you can do. And then work up to walking, putting them all together and actually walking. But it wouldn't be exercises like the straight leg raise, like I demonstrated or showed before of lifting up, lifting down. That would not necessarily have the same level of improvement for you as these exercises. Okay, we can move on to the next slide. So we have 3 exercises right now. So what I want you to do is make sure you are in a comfortable position and you have a little bit of space around you. So this first one that we're going to do is a strength exercise. This is one of my favorite exercises that I personally feel anyone with MS should do. And even if this is easy for you, or even if this is so hard and there's no movement, everyone should be doing this. So with this exercise, I'm going to show you again as well. With this exercise, what you're going to do, ideally sit up tall, core muscles are tight. You can hold on if you need to. Slowly lift one leg up as high as you can, and then lower it down. And then the other leg all the way up and lower it down. If this is too challenging for you, you can actually recline backwards a bit, and that makes it a little bit easier. And up and down. So keep going with this exercise. I'm going to continue talking to you and explaining it, but I want you to keep going. The reason this exercise is important is because when we're walking, this is the same movement. You're just sitting instead of standing. So eventually you might do this in a standing position. Or if you need to get into a car or out of a car, you have to be able to lift your leg up and over and then up and out. This exercise strengthens your hip flexors, which we use in so many things throughout the day. And one thing that I want to point out about this is likely you might have a side that is weaker than the other. Excuse me. Can you take a sip of this water now? So it is very normal to have one side of your body that's weaker than the other side. So if you have a weaker side and there's no movement right now, keep trying. Your brain, what I want you to think about is your brain, every time you attempt, even if there's no movement, try to do this exercise, your brain is trying to find a way to get from here to your hip flexor. And over time, research shows that that will happen. And again, it's not going to be miraculous. It's not going to be a huge movement, but it might lift a centimeter, and then 2 centimeters, and then 3 centimeters. So it will improve over time. And if you do have some movement, so maybe it does lift, but it's not as good as the other side, and it's heavier and it's harder, keep practicing. You have a pathway that's working, so let's keep it strong and get it even stronger if possible. So this is one of my favorite exercises. We'll move on to the next one. And the next exercise is balance, because as you just saw me practice, all while those things were happening, as my one leg was coming up and through, I was standing on one leg. And what I hear a lot is, oh, well, I have an assistive device, so I don't need to stand on one leg. And that is true. When you have an assistive device, you do have, excuse me, you do have something helping you, but we should never be putting a lot of weight through our assistive devices. They are not meant to withhold our full body weight or even most of our body weight. So if you are doing that, that I would consider as a safety risk or a fall risk. And the better your single leg balance is, even if you are holding on to something, the better your walking will be, the safer your walking will be. So this exercise might be too challenging for some people. And I also hate that he's using this chair in this photo. Please never use a chair like this for balance. Make sure it is something sturdy that will not move. The goal of balance exercises, the goal of what you use to help with your balance exercises, is that if you do feel a little bit tippy or like you might fall over, whatever you're using to help out will prevent a fall, whereas this chair would just fall right on over. So for this exercise, if you are practicing, again, not the best chair, this is a swivel chair, don't use that one. However, actually, we'll use this. Hold up tall, core is tight, and if you can, take one leg off the ground, one leg is down, and then let go with one hand, another hand. If that's too wobbly, maybe keep a couple fingers on. You don't just want to jump to, okay, hands are off and I'm standing on one leg. And if that's too challenging, there's so many other ways that you can get there. You could try standing with your feet together, feet apart, somewhat of a staggered stance. All of those positions are helpful for walking, as well as for just things like standing and reaching for something. We need to be able to balance well in order to not risk falling over. So this is another one of my favorite ones. On the next slide is one for proprioception and coordination. So a really important thing with walking too is to put your foot where you want it to go. I can't see your hands right now, but you can participate anyways. By a show of hands, how often when you walk do you actually put your leg where you want it to go versus crossing over or crossing too far out? I see that all the time, where instead of one foot staying in the right alignment, we'll cross this way or this way. And it's often the issue where people say like, oh, people think I look like I'm drunk when I'm walking. This coordination and proprioception is the issue there. So she's standing, but I normally like to do this exercise sitting on the ground. So not sitting on the ground, sorry, sitting in a chair. So what I want you to do is sit up nice and tall if you can. And you can't see my feet right now, but I happen, luckily, to have a feather on the floor right there. However, if you have a design on your floor, or if it's tile floor or hardwood floor, pick a point on the floor. Doesn't matter what it is. It could be a penny, it could be something on the carpet, whatever it is. And I want you to lift your leg up and tap your heel on that item, that thing that you want, that you say you touch, and then bring your leg back, and then the other leg, and then bring the leg back. Make sure it's not something that's too far away from you. It needs to be relatively close, and bring it back, and just practicing this coordination of my heel is going to go right there and making it go right there. Ideally, with this exercise, you would use something that's small. Maybe it is as small as a penny, because the more precise, the better. But for some people, that's too hard at first. So you could even use something like your phone. Like, it doesn't have to be super small, but just getting your brain to practice putting your foot forward and then bringing it back exactly where you want it to go. All right, next slide. Okay, so the newest guidelines, write this down if you have pen and paper. So first of all, aerobic exercise first. So doing aerobic exercise before you do these other MS-specific exercises has been shown in newer research to actually prime your brain for neuroplasticity, which is amazing. When I first heard this, I literally I almost jumped up with joy. I'm like, are you kidding me? Like, not only is neuroplasticity possible, like you can actually get stronger, but you can improve your odds of that by doing aerobic exercise first. And aerobic exercise doesn't necessarily mean running on a treadmill or even walking on a treadmill. There's tons of ways that you can get aerobic exercise in without fatiguing your legs. The next one is high repetitions. So with neuroplasticity, the only way to get it to work and to improve the neural connection and improve the muscular strength is high repetitions. So over and over again practicing. And then also perfect quality, because we want our brains to remember the good quality rather than bad quality. So we have to be doing more perfect quality ones, which requires lots of rest breaks. So these are the things that you should be implementing when you're doing your exercises. On the next slide, I have a couple of other guidelines. So one thing that a lot of people tell me is, I just don't have time to exercise, or I just can't do all of my exercises. And this first line that I have here, distributed is equal to mass. What I mean by that is research is now showing that exercising throughout the day, 5 minutes here, 5 minutes there, 10 minutes here, is just as effective as exercising all at once. So if you have 5 minutes here, 15 minutes, 10 minutes, just sprinkled throughout the day, do your exercises in that time. It's just as effective. The second thing is that a variable environment is better than constant. I had a perfect example of this where I was working on standing up and sitting down from a chair with one of my patients, and she did it perfectly in the PT clinic, and someone, or her husband, came to the session one time and said, Dr. Gretchen, I don't know what you're doing that's magic in here, because I see her do it with you and she's perfect, but we go home and she's not doing it well at all. And as soon as he said that, I was like, we're literally doing it in the same room, in the same chair. So from then on, we practiced in all of the different rooms in the PT clinic. There was a neurology clinic across the hall that I worked with the neurologist there. So we'd go over there. We sat in their waiting room chairs. We would practice everywhere. Variable environment is better than always doing it in the same place. And lastly, a random order is better than blocked order. So for example, those 7 things that I mentioned earlier for walking, you wouldn't want to practice them all in the same order. You'd want to mix it up a little bit. Random is better than always practicing in the exact order that it belongs in. Okay, next slide. So how to be consistent, because this is something that a lot of people struggle with. You might know what to do, and now hopefully you do feel a little bit more clear on what you should be doing, but consistency is really where all of this comes into play and where you'll notice the long-term benefits. So one thing that I want to mention here is that research does show that if you have MS, you should be exercising 5 to 6 days a week. However, there is also research that shows 2 days a week is still enough to get some improvement. And the reason I want to point that out is because so many people will say, well, I didn't exercise at all yet this week, and it's already Friday. I guess I shouldn't do anything. I'm not going to get better at this. So just keep in mind, 2 days. If you get 2 days, be proud of yourself and try to improve from there, but 2 days still can show improvement. The next one is that make daily movements exercise. If you don't enjoy exercise, or if you don't feel like you have time to do all of the exercise, if you have to grab something from the fridge, squat down. There's an exercise for you. If you need to practice balance, maybe as you're waiting for your coffee to brew, you can practice balance. If you need to practice standing up and sitting down, every time you stand up and sit down, then use that, go slow, and use that as an exercise. If we could go back to the last slide for a second. Sorry, there were 2 others. The third one is to start with one exercise. So if you feel overwhelmed, you have a lot that someone has been telling you to do or that you want to do, just start with one. Pick your favorite one. Maybe it's the easiest one, and just do one exercise each day or most days. And then once you're in a routine of that, add a second one, and then add a third one. And then the last note on this slide is just to make a plan. If you are someone who's just like, I'll exercise at some point today, you're less likely to stick to it than if you say, I'm going to exercise at 2 p.m. today. And with MS, obviously that's really hard to do. 2 p.m. might come around and you're just not feeling so hot, but it will at least get you started in a direction of making a plan. And if consistently around 2 p.m. isn't great, maybe 11 a.m. or 4 p.m. So everyone's going to be different, but attempt, if possible, to make a plan. Okay, now we can go to the last slide. And I do see some questions coming through, so I will be going through those. There are lots of there's so many resources out there in order to get more of these exercises. This is not a long enough presentation where I can give you guys all the exercises. I do have a YouTube page. I do have an Instagram, Facebook, all of that. So hopefully you guys can find those as valuable resources. And let me pull up some of these questions. Dr. Gretchen, do you do consults for patients in the UK? So I'm a licensed physical therapist in Massachusetts, New York, and Maine, all in the United States. So legally, I am allowed to treat patients in person or via telehealth in those states. So not in the UK. However, that is one reason that I actually created The Missing Link, my online MS wellness program, because that is a way that I can put all of this education and exercises and everything together, and anyone can use it all throughout the world. So that might be something that you can look into. Let's see, foot drop exercises. So my favorite foot drop exercise, I'll use my hand just to show you. If this is my knee, this is my heel, these are my toes, so slightly use your imagination, but I think you can tell. Foot drop, obviously, is when your toes drop, and that's exaggerated, but when your toes drop or you don't have as much strength. So one question that people ask me a lot is, if there's one thing that I should do, what would it be? And my answer is always, do the thing that's hard. So if for you, if it's foot drop, lift it up. Practice lifting, practice doing the thing that's hard. This is my favorite. It's so simple, but it's my favorite exercise for foot drop. All right. So I'm going to take one more question. Sorry, I know I talked for a while. My email is open. Please email me if you have any questions. Let's see. Thoughts. Can I send resources? Yes, I can share this slide. Someone is hiking, partial numbness in my feet and my toes. I think that going on hikes and very textured paths helps by stimulating my feet and toes. I notice a sensation more because it is varied. Yeah, and today's presentation is just on exercise, strengthening exercise. There are so many different ways of working with your body, like this person's saying too, getting on different surfaces, rough surfaces, uneven surfaces, as long as it's safe for you. There's sensation exercises, there's stretching, there's so much. So neuroplasticity occur if I've been numb for neuroplasticity isn't for numbness, it is for strengthening. All right, guys, I'm going to stop there. If you can, shoot me an email, reach out to Mindy or some other way. I'd love to answer other questions, but my time is up. Thank you so much for listening, and I hope you got a lot out of it.